Alphabetically, Andrés Mantilla, Cáceres Mantilla, Ycaza Mantilla. He's a politician, he's a lawyer, a professor on international property with a PhD on intellectual property. He has taught in Santiago and Guayaquil University. In 2007, he was regional undersecretary of the Ministry of Industry and Productivity. He has implemented deconcentration processes of the regional undersecretaries and the development of micro companies to fight poverty among infants. In 2009, he became director of the Ecuadorian Institute of Intellectual Property. We have here Duchkevich. He is he's part of the Brazilian intellectual property from Brazil, and he's the coordinator of the Defense Center of Intellectual Property. And the third, Tomás Pipo, he's an economist, director of health economy in the ministry in Argentina, and coordinator of the technical team of universal access to medicines of the South American Council. So we will start with panel number 2. If you can start. Good afternoon. First of all, let me thank the South American Institute, the ISACs, for the organization of the event. As an Ecuadorian institute and as part of the Ecuadorian Institute, it is very interesting for us to explain the intellectual property policy we've implemented to expand access to medicines. We work with the Superior Secretary of Innovation and Technology, that is the one that decides public policies in Ecuador. We have developed or we have tried to have this as a transversal tool to improve quality of life. So we have implemented certain public policies. First, Ecuador government has made huge investments in access to health. We have a pharmaceutical state-owned company, Pharma, created in 2009. The purpose is to have an R&D campaign on active principles to produce medicines and to provide the ministry with medicines. We are working on providing universal access to medicines, and we are working on supplying medicines from state-owned companies. As to HIV, in Ecuador, the government has made historical investments. The response to the fight against HIV is 100%. We have universal production of medicines for HIV-infected people. From 2007 to 2014, more than $7,000 million were invested in health. The three governments that were there before us, the investment was less than half. So investment is huge, and we have to take care of investment and foster access to health. The Constitution says that we should guarantee, without discrimination, the exercise of rights stated in the Constitution and international instruments, especially education, health, food, social security, and water. The Constitution says that access to medicines should prevail over economic and commercial interests. Economic and commercial interests cannot prevail on public health issues. The National Plan of Welfare sets that universal access to medicine is essential and it should be supported by the state, and we should use compulsory licenses. The standards in Ecuador, well, we are members of WHO. We have the Andean regulation. We have the intellectual property law from 1998, one working on a reform based on social economy and knowledge economy. So we see that some standards have been barriers to apply certain public policies. However, we were able to implement.
We have high patentability criteria. We still have we already have patentability guidelines, and we apply them in the IP office. We have patentability criteria on polymorphs, pseudopolymorphs, Marcus formula, etc. We don't grant patents on these kinds of for these kinds of applications. As part of the IP policy, we have also applied the system of rates or fees. Fees in Ecuador before 2009 were very low. In most countries, I think the scenario is the same one. Patent applications for the pharmaceutical industry. The pharmaceutical market is a market of $1,400 million. In the past, we would charge $28 for an application, so that meant granting a monopoly to a pharmaceutical company for just $28. It was quite amazing. So they would pay for the 20 years in just 1 year. So we also realized that there's another issue, the issue of patent pending. They submitted requests for the same active principle, the same molecule, 20, 30, 100 times. And this increased the workload of our IP office, so in order to analyze patents, which actually had no reason for existing. These had patents which we call thrush patents. So we created a patents policy, and we emulated the rates and fees charged in developed countries. So we started charging much more per application, and we began to charge maintenance fees which were progressive, so that if the patent or the owner of the painter could afford the payment of the patent and the maintenance fee, this means it was a product for which this person should not, or this organization should not have an exclusivity right. All these measures have helped us quite a bit. The number of applications for patents has dropped significantly. And in this way, there has also been a reduction in the workload related to patents pending. Nowadays, all applications are much better prepared. Patents or products which really deserve the protection of a patent. We have done the same in plant products or plant varieties. Most of the requests for patents, 95%, belong to owners living in developed countries, usually in medicines, agrochemicals, and metal mechanic industry. Most of the owners of patents don't have investments in the country. They are just submitting the applications, and sometimes the product is not in the country even. We have already talked about patent pending. Some applications are analyzed for 8 or 10 years, and eventually they are not granted a patent. So we had a resolution, as I said, that changes the fees to be paid for a patent. Additionally, we grant a 90% discount in order to drive innovation, a 90% discount for patents for plant products and applications submitted by SMEs, universities, farmers, etc. With this, we want to drive or encourage these sectors to submit patent applications. So the small players pay lower rates. Thus, the patent applications that are not very relevant, which are not worthwhile, which don't deserve the protection, well, they are not submitted that often any longer. We also have Article 31 in the TRIPS that talks about other non-authorized uses by the owner of the patent. These are mandatory licenses. We have applied this according to the Section 486, Article 65, which states that mandatory licenses may be granted if there is a public interest underlying. In Ecuador, through Decree 118 from October 2009, it is said that access to medication is an issue of public interest. Unlike other countries, in Ecuador, access to medication is declared of public interest. Therefore, mandatory licenses may be granted on drugs which are used to treat diseases which affect the population in Ecuador. So any drug that is used to treat diseases that affect the Ecuadorian population may be granted a mandatory license. The first case we had in this case was in January 2010. It was in the case of ritonavir, a drug used to treat HIV/AIDS. When the reverse auction was carried out, the price dropped by up to 30%. The second case was the case of another antiretroviral, lamivudine plus abacavir, where again a mandatory license was issued and the price was reduced significantly between the price it is sold for in the market is $753, and according to the mandatory license, the new price would drop quite a bit. For the time being, we have already granted 9 requests for mandatory licenses. We will make it to 10 before the end of the year in different kinds of medications. What we want to do through this system is to create access to medications. The Ministry of Health is acquiring large amounts of medications, and it's necessary to expand the coverage. And very often, because of the high cost of the drugs, the Ministry of Health is not able to buy everything it has to buy so as to create full access to the medication. That's why we are using this tool, so that large amounts of agents could be bought at a lower price. This is a list of the mandatory licenses that have already been granted. We have antiretrovirals, agents to treat pain in the case of rheumatoid arthritis, and also agents, cancer drugs. There are we want specific companies to call for more, or to ask for more mandatory licenses. We believe that one way of creating a competitive market is to work with generics too, but there is another issue here. We have areas where there are drugs which are not patent protected, which, however, are still one of the most expensive drugs. This is a list of products which are not patent protected, but they are still produced by one company, so their prices are quite high. A recommendation, while it's necessary to work in the region in order to improve access to medication. So it's very necessary to drive within UNASUR, the South American Health Council, to work on these issues. So I really thank the ISACs, and I urge them to start working on these issues to create regional policies so as to improve access to medication. Thank you very much. This is our contact information, and we are willing to answer any questions or requests you may have.